Hi, welcome to Senior Circuit. We're here today with Natasha and Molly, two social workers from the Council on Aging. Thank you so much for joining us. We're here today to talk about open enrollment, which is in the forefront of a lot of people's minds, especially if you're about to go on Medicare or if you already are on Medicare and you're looking to make some changes or just thinking about things, right?
Mm-hmm.
But before we get started, why don't you tell us a little bit about yourself? Go ahead, Natasha.
Yes. Hi, my name's Natasha. Naim, social worker at the Somerville Council on Aging. I've been here for 10 years. Very excited to be here today.
Great. And Molly, how about yourself?
My name's Molly Pagliuca. I'm also a social worker at the Somerville Council on Aging, and I've been here for almost 2 years.
Great. Thank you. So in addition to your work as social workers every day, we know you go out to the community, you set up educational events, you help people complete forms or access services. A large focus of your work during the fall is open enrollment because you're both SHINE counselors, which gives you a little special certifications. Why don't you explain to everybody what SHINE counseling is and what SHINE means?
Yes, SHINE means serving the health insurance needs of everyone. If you're a person who's eligible for Medicare, whether you're 65 and older or have a disability, we can help you choose the best plans, understand coverage, and answer questions about health insurance in general.
Yeah, and that's work that you do throughout the year.
Yes.
But during open enrollment, it ramps up a little bit. So Molly, why don't you share with everybody what open enrollment is and what it means?
Sure. So open enrollment is a special time each year where Medicare beneficiaries can change their supplement plans or their Part D plans or both. It's from October 15th through December 7th, and the changes will take effect on January 1st.
That's great. So sometimes people might not be happy with their plan, or they might not have the coverage that they feel they need, or sometimes they've had a change in their medical status, you know. Sometimes for the better, sometimes more concerning, and the coverage isn't quite what they need anymore. So this sounds like the time where people can make these changes if
definitely.
they need to.
And some plans sometimes can change at the end of the year for the following year. So people don't like those changes and they want to switch to a different plan.
Exactly. And this isn't about your actual Medicare Part A or your Medicare Part B, but it's the supplemental plans. And I think that's a little bit about what I have questions about next, that we hear Part A, Part B, Part C, Part D, Advantage plans. I mean, maybe you could help explain or a little bit of an overview of what all those parts are.
Glad to. So yes, Part A is for hospital coverage. If you're in the hospital for an extended period of time, Part A is what pays for that. Most people get Part A for free. It's mostly what you get when you turn 65.
And that's what you cannot change.
You can't change that.
No, you just have it. It's of no cost to most people, and that stays the same.
It does, yes.
And what about Part B?
Part B is a little different. Part B is for doctors' services. Most people pay $174.90 per month for it. It can happen when you retire from work, you get Part B. For people who are still working, though, this is a very important point. If you have employment coverage through your employer, you can forego Part B until you retire. When you do retire, though, you need to have Part B.
Right, because there may be a penalty.
A lifelong penalty,
correct?
actually.
Right? I mean, I think maybe not really under the open enrollment umbrella, but there are some services that you provide if people find it difficult to pay that copay for the Part B. And can you explain a little bit what about that's called?
Definitely, yes. So many people might not know this, but there is a special program called the Medicare Savings Plan or the Mass Health Buy-in. If you make under a certain amount of money every month, you'll be able to have that $174.90 premium paid for every month, which is exciting news.
And especially exciting because there was a little bit of a change recently, right? And
asset limit, which
Yeah.
was a real barrier for many people. But starting this year, actually, no more asset limit, which is very exciting.
Yeah, I mean, that sounds like maybe your assets or how much money that you have in the bank.
Yes.
They used to be taken into counted and used against this benefit,
Exactly.
but now it's not counted at all. So even if you've applied before, Molly, would you say like they should apply again for it?
Definitely. Now that the asset limit is eliminated, a lot more people qualify. So I would recommend applying again.
Okay. And they can do that right in your office.
Yes, it's a very simple application. Takes only a few minutes.
Yeah.
2 pages. Very
Right.
exciting.
Yeah. I mean, we distracted ourselves a little bit because your Part B, if you're, if you are retired and you have Part B, that won't be changing. Part A won't be changing.
Exactly.
But there are some other parts of your Medicare coverage that you can change
Yes.
during open enrollment. And let's get back to talking about
Definitely.
those.
My apologies,
Yeah.
yes. But Part D for drug coverage, you can change that during open enrollment. You can also change the Part C plan. Now, this is a little confusing because Part C is the Medicare Advantage plans, which are Part A, Part B, and Part D, all in one coverage. A little confusing,
Yeah.
but still important
Those
to know.
are more of what you see advertised.
Yes, yes. You probably see them
Yeah.
on TV, Medicare open enrollment, Medicare Advantage plans. The ads are out there.
Yeah, and that's what can be changed.
Yes, that can
right?
be changed.
So, there's a lot of ads and there's a lot of things to shop around in. But so you're looking at the Medicare Advantage plans
Yes.
that can be changed, and are you looking at supplemental plans that can be changed?
Yes, and Part D as well. Yes, that can
And
be changed.
what about supplemental? What would you describe those plans as?
Yes, so you have the Medigap plans and the Medicare Advantage plans, or the Part C. I'll go over Medigap first. Medigap covers the 20% that Medicare A and Medicare B do not cover. Medicare pays for 80%. You as a beneficiary are responsible for 20%. That can be quite a bit of money if you're going in the hospital for surgeries or any sort of treatment. That can get quite pricey. Some people elect to get the Medigap plan to cover those costs. Another way to supplement your Medicare is Medicare Advantage plans, or Part C. Part C is A, B, and D all in one under one company, such as a whole host of companies. They take over for Medicare and they cover things. They may have extra benefits like dental, vision, and hearing. But an important thing to note with Medicare Advantage plans, they have their own networks. If you have a doctor who you really like and you want a Medicare Advantage plan, you have to make sure that doctor is in the network, because if they're not, you may not be able to see them.
Right. So it sounds like it's a really individualized decision for
It is.
everyone, and what works for one person might not work for you, and maybe even what works for one person in your family might not work for you. And that would that be when people would come and see you directly?
Yes.
Correct.
Many people say, what's the best plan? And I always say, it depends. If you have a certain amount of needs, one plan may be best. If you have other needs, another plan may be best. People, these are all just individual plans. They're not family plans, they're not group plans. Your plan is your plan that's best for you, and we can help you navigate that and choose the best option.
That's right, because there's so many advertisements sometimes, and taking into account what is working or what isn't is really what a Shine counselor does.
Yes.
Is that right? When you're in individual sessions with you, you're looking beyond just the Medicare coverage or just the prescription drug coverage.
Yes.
Yes.
Everyone's different. People come to our office a lot talking about different things they've gotten in the mail and different advertisements they've seen, or plans their friends have recommended. But it's like Natasha said, it's very tailored to the individual person, their overall health, upcoming surgeries, prescriptions that they're on. So it's best they meet with us so we can help counsel them to see what correct options are there for them.
Exactly. And there is also the other option of not changing anything. Is that right? What happens if you don't make any changes during open enrollment?
If you don't make any changes, you're automatically re-enrolled for the next year in the same plans.
Great. So no coverage will be eliminated or deducted from
Exactly.
you, but plans may change.
Yes, plans may change. You'll probably get in the mail a list of changes. Hold on to that and look at it, because in the fine print they may say deductible is going up to this amount, we're not covering this medication anymore. It's important to make sure that you know all the changes, because if you try to change during the year, you may not be able to.
That's right, because the open enrollment is open enrollment for a
Exactly.
reason, right?
Exactly.
It's the time when you can research and make the changes. And there's one final part of Medicare coverage, and that's Part D coverage.
Yes.
And can you explain a little bit of what Part D coverage is?
Sure. Part D is prescription drug coverage. That's one of the things that you can change during open enrollment. Some people will say, well, what if I don't take any medications? Why would I need a Part D plan? It's because if you don't have a Part D plan or credible prescription drug coverage when you're 65, if you need it in the future, for example, if you get prescribed a medication a few years down the line and you do need a Part D plan, you'll have lifetime penalties that you'll have to pay forever. Because you didn't sign up when you needed to. So we just recommend having one when you turn 65, and it's probably will be low cost if you're not on any medications anyways.
Because Part D plans range in the copays, and some can be a few dollars a month, and they can go up. And is there any advantages, do you think, of getting the most expensive Part D plan?
No, it all depends on what prescriptions you're on and which plan covers which prescription. And like we said, everybody's different. The way we help people figure that out is through the plan finder on Medicare.gov. We can type in your prescriptions, your dosages, your preferred pharmacies, and it will show us the lowest premium and drug cost options for you.
Because it's my understanding that sometimes you could be on a prescription and come January 1st, the Part D plan no longer covers that, or covers that in a different way. Is that true?
That's accurate, because plans can change as well as beneficiaries can change. And those changes can be really dramatic. I've had people come in and say on January 2nd, I have this plan, I like this plan, but the plan's no longer covering the medication. And they're shocked, because these plans do change. Deductibles change, co-payments change dramatically, even premiums change. So we really want people to look at their changes and say, does this still work? Because it might not.
And is that something, so a Part D plan is for people who don't have the Medicare Advantage plan, because you mentioned before that under Medicare Advantage, your Part D plan is rolled into the Part C plan.
Yes.
So perhaps like that's one thing that they would talk to you about, is if their prescription drugs are covered and in what manner. That could be a deciding factor between the Part C and the Part D plan.
Usually is. It's dramatic to see how much coverage you can have with one plan versus another. Many people will come in and say, I don't know if I should change or not, but the savings are dramatic. You can go from paying $20 for medication to only $2. That's a lot of savings. And you're leaving money on the table where you don't know can hurt you and hurt your wallet too.
Exactly. It sounds like it, because you mentioned even which pharmacy you go to may play a factor.
Exactly. Yes.
Now, we did say that there are some Part D plans that cost a few dollars a month. There's some that cost many more dollars than that. But is there any assistance for people if they are unable to afford a Part D plan?
Exactly. We get this question quite a bit. Prices are high, inflation is real, but there are different programs such as Extra Help that are able to cover the cost of prescription drug plans and make costs in general more affordable. Prices for medications are going up. deductibles are higher, it's a real threat to people's sensibilities and to people's finances. We are able to help navigate people as they are seeing these struggles with medication, find alternative ways to pay for it through either extra help, prescription advantage. There are many programs throughout the state that are able to assist with these costs. We want to help people access that.
Sure. So many people think Mass Health is a helper for people,
Yes.
Which it is, but you mentioned that there are other things beyond Mass Health standard.
Yes.
You said that there was some extra help.
Yes.
Could you explain what extra help is beyond extra help?
Exactly. Extra Help is capitalize a program through the federal government that recognizes that drug costs are expensive and some people can't afford that. Extra Help eliminates the higher copayments. It caps the amount you'll pay for medications. I forget the exact amount, but it's no more than $7.40 for the highest tier drugs. So you'll be able to afford things. You get a very expensive medication throughout the year, the middle of the year, and you're concerned, there's programs available to assist you.
And Extra Help is income-based?
Yes, it is.
The buy-in program, we talked a little bit about that, but that's another program that provides assistance to people.
Yes.
And then there's also Prescription Advantage. You mentioned that as well.
Yes. So Prescription Advantage helps with the thing called the donut hole. The donut hole is when Part D drug plans say, we've paid enough and you've paid a certain amount. We're just not going to cover you for a little bit. And that's scary. That donut hole can cost you quite a bit of money. And if you're taking very expensive medications that you need to stay healthy, you want to consider getting on Prescription Advantage if you're able to afford it. It will help you alleviate those costs, which can be catastrophic, and helps you get out of that donut hole where you'll have more coverage. But that gap in coverage is what Prescription Advantage assists with.
Exactly. So I think maybe just explaining the donut hole to people a little bit more. The donut hole is, something that everybody may face in their lifetime.
Yes.
I don't know if you want to explain it a little bit more in detail of what the donut hole is.
Definitely, yes. The donut hole is the gap in coverage where your plan pays a certain amount of money and you pay a certain amount of money. When you reach, I think it's $5,000, where the plan has paid and you have paid, your plan says, we're not going to cover you for a little bit. Very scary, very alarming, and you're responsible for the majority of those costs. Those costs can be hundreds of thousands of dollars. And that's a shock to a lot of people. When people reach the donut hole in the middle of the year, near the end of the year, they're shocked by these intense prices. And we can help navigate you through that. If you're someone who says, I might hit that donut hole, I'm paying a lot of money, the plan's paying a lot of money, I might hit that amount, definitely come and see us because there is Prescription Advantage, which will help with that donut hole. It won't be as devastating. There is assistance available for people who do hit that donut hole after paying thousands of dollars.
Exactly. It sounds like when you have a Shine appointment with somebody, you're kind of hitting on different topics. You're hitting on your prescription coverage. You're hitting on what assistance might be out there, and also really an overview of what insurance plans are there. And it sounds more like you're not determining a health insurance plan for people, but you're giving different scenarios and different options for them to be more informed.
Exactly, yes.
Yeah. I think also a thing that you take into consideration a lot is that you help people apply and stay on Mass Health, and Mass Health coverage is, I'll let you describe what Mass Health coverage is.
Yes. Many people think there's just one Mass Health coverage, Mass Health standard. It is the gold standard, really, for coverage. If you have Mass Health standard, it's great. It pays for co-payments, it pays for doctor's visits, hospital visits, things like that. But the moment you turn 65, things change. Many people want to stay on Mass Health standard. They're excited by it. They love it. It's great. But when you turn 65, Medicare becomes your primary insurance. No matter what happens, Medicare is primary, and Mass Health is secondary. Many people think that Mass Health standard goes throughout your lifetime and has the same income and limits. When you turn 65, you have an asset limit for Mass Health standard and a lower income limit. So many people are unfortunately unable to continue on Mass Health standard. And that's a shock to people. We'll get a notice saying you're no longer eligible for Mass Health standard, but nothing has changed. But things have changed. You turn 65 and Medicare is now your primary insurance. So it's important to know that you have to get Medicare. Even if you are still eligible for Mass Health standard, you still have to get Medicare. Many people will ask me this, but the answer is the same. You have to get it if you're eligible.
And Molly, what would you say, you know, if you turn 65 and you have to apply for Medicare and you may or may not be eligible for Mass Health based on the income or asset limits, would you still recommend people reapply for the Mass Health Senior Plan?
I would recommend it, yes. You can be eligible for different programs through Mass Health, so applying and seeing doesn't hurt you at all. And it's an application that we can help with in the office. So we definitely recommend applying for both. If you're dual eligible for Medicare and Mass Health, it's really great coverage. So we want to make sure and see if that's something you could be eligible for.
Sure, like Natasha mentioned, it may be the gold standard of care, but the gold standard of care is also in some of the other plans with the Part C plans or the Part A, Part B, and Medigap plans. You can get that gold standard through all these different pieces and all these different scenarios, it sounds like.
Yes, many options available.
Many options, and just kind of seeing what is right for the right person.
Yes.
Yeah. So it sounds like there's not one answer for everybody, but maybe the answer is to meet with a Shine counselor, or is it possible for people to go to the plan finder or go to different resources to look on their own?
Yes, it's possible. The plan finder is located on medicare.gov. It's pretty simple. You type in your zip code and then you enter your prescriptions and your preferred pharmacies, and it will come up with different plan options for you. But we're more than happy to help do that with you, at least if you wanted like a tutorial for the first time.
Exactly, because things change, but it's also important to remember that what you pick now is the plan that you're going to have on January 1st. And then are there any ways to change your plan throughout the year, or is it only during open enrollment?
There are some different special enrollment periods for people, but that's based on different things, like if you move out of your coverage area, you're retiring, things like that.
So it has to be a true life change, whereas open enrollment is really the time period where you can everybody can change, and you have a little bit of time from October to December to meet and hear your options and really consider what's right for yourselves. I mean, I think we talked about a lot of different things.
Yes.
We talked about a whole lifetime of health insurance in a few minutes. Where can people go to receive assistance or to schedule a Shine appointment?
People can call us directly at the Council on Aging. People can call the Shine program directly and they'll refer to the closest town. But for Somerville, it's easiest to just call us directly.
That's right, because we are fortunate in Somerville to have 2 Shine counselors, the both of you right here within the city, and then you also receive some guidance and some oversight from the Shine office,
Yes.
your main Shine office out of Middlesex County. So there are options for people to
Yes.
definitely connect and learn more about what's right for them. So thank you so much
Thank you.
for being here today and sharing about Shine and open enrollment with everyone.
Thank you for having
Thank
us.
you.
Thank you.